jaws, and therefore when the leech attaches and bites, so we have this sign which looks like Mercedes-Benz. If we look a little bit closer to these jaws, we see that they are composed from 60 to 80 teeth, and next to each teeth on the right side, you see there is a canal, and from here, the saliva is injected to the wound. The saliva it's composed from a large amount of anticoagulants, as you can see, vasodilators, and spreading factors, which makes that the blood, that the bite site can bleed for hours, as we will see. And because there are so many anticoagulants which are acting on the cascade of the coagulation, it is very difficult to the organism to stop the bleeding. That's because a bite site can bleed for 12 hours and more. We are using this, the leeches, especially in the plastic surgery, and in just a classical case of amputation of the finger as a result of an accident. As you know, after the different parts of the lost finger, it is reattached. The physicians have apparently difficulties to connect the veins. It's easier for them to connect the the opposite of vein, the arteries, but then they cannot do it with the veins, so there is a venous insufficiency, and as you can see it schematically, there is a lot of blood which is coming inside and staying inside. They can't come out, which makes that the color of the finger starts getting more and more darker, and as a result of it, the patient can lose his finger. And for the treatment, before all, the patients are informed about the benefits and potential risk of the treatment, and their consent is obtained. Prophylactic treatment, I will talk immediately, will be applied. Leeches are rinsed thoroughly with sterile water, just to remove the bacterial load which is on the leech when we remove it from water, and the wound is cleaned from existing gels, and we take all kinds of precautions in order that the leech will not fall inside the dressing after it falls, and it causes some stress and inconvenience to the patient and his surrounding. By wearing latex gloves, there is no danger that the leech will bite the therapist. The apical part, usually of a 5 milliliter syringe, is cut with a scissor or scalpel. The leech is introduced, like you can see it in the picture, in the barrel, and the opening is closed with the finger. The finger is removed from the syringe, and the leech is released in the area where the leech therapy should be applied. The syringe is removed slowly when the leech starts feeding, and in case that the leech refuses to feed in a given place, because as you understand the bleeding is very bad in these areas, then the syringe is moved to the neighboring area until an appropriate place is found as close as possible to the congested area. Sometimes it helps to puncture the skin with a sterile needle so that oozing blood will stimulate the leeches to feed. Leeches are placed on the regions of the removed nails, if there is such a situation, as you can see it on above picture, and or in the darker spots of the congested tissue. Depending on the severity and the size of congestion, 1 to 10 leeches are used for each treatment, Especially at the beginning of the treatment, the patient can receive 2 or more treatments per day. Leeches are being used until angiogenesis was established. Usually the treatment lasts for 2 to 6 days. Bleeding of the bite area is often allowed for 12 to 24 hours, as long as there is venous congestion, and accordingly, hematologic evaluations should be performed regularly, and in many cases, the patient should receive blood transfusion. I will show you 5 cases also in this part, and this is a 44-year-old male patient who was admitted to the emergency room with an avulsion of the palps of the 5 fingers of the dominant hand, the right hand here, and the exposed digital phalanxes were covered with 4 digital island flaps. But venous congestion was seen on day 1 postoperatively, and leech therapy was initiated. Leeches were applied once daily for 3 days until the venous congestion was improved. And here you see the case 2 months later, postoperatively, the patient regained full function of his finger hand, including a normal handwriting, allowing him to go back to his work as a school teacher. In the second case, an 8-year-old girl was admitted to the emergency room with amputation of the palp of the right dominant hand after a door was closed on her thumb. The palp was sutured back, but underwent gradual necrosis during the next 10 days, with exposure again of most of the distal phalanx. To avoid skeletal shortening, a thumb reconstruction was performed using a free flap taken from the lateral hemipalp of the big toe and transferred to, and the patient was discharged with a viable flap on postoperative day 11. At 6 months, the function and sensory function of the thumb was normal, allowing a normal handwriting. This gentleman, a 22-year-old male patient, lost his entire hand after an accident, and soon thereafter it was reattached. However, a large area in the inner side of his forearm, if you can see it on the upper part of his hand, was lost, and skin graft was implemented. Soon thereafter, the skin became dark and venous congestion was visible, showing that he would soon lose this transplanted tissue. Leech therapy was initiated, and after 3 treatments, large areas of the skin became pink, and the bite sites were bleeding for long hours. In the 5th day of the treatment, the graft was looking healthy and it was saved. Hirudotherapy was used in cases of surgical removal of cancerous tissues and skin grafts to cover the missing parts, as in this case of the lady. Also in cases when the scar tissue in the face was removed and replaced with healthy one by tearing the skin from the area of the neck, and we had the same problems also here. I would like to talk a little bit about the symbiotic bacteria. As you know, leeches are not sterile. They have symbiotic bacteria of the group Aeromonas, like Hydrophila, Veroni, Sobria, and which are very important to the leeches, which help the leeches to digest the blood. They give them the vitamin B, and the Aeromonas bacteria produce themselves all kinds of antibacterials which neutralize other bacteria which are in the blood in order, which could be detrimental for the leech. And for prophylaxis from these aeromonas, which can really feel, because we are working with open wounds and the aeromonas come directly in contact with the open wound, as we give always a prophylactic treatment, usually 500 milligram of ciprofloxacin per day of treatment. If there are 2 or more treatments in the same day, and there are a difference of 4 days, interval of 4 days, so the patient receives another 500 milligram of, and very importantly, that this antibiotic should be given 30 minutes before the treatment in order that the concentration of the antibiotics is the correct one. Since 2003, we treated 45 patients, and which were presenting with venous congestion or revascularized fingers, free or local flaps, and also, as you saw it, surgical wounds after scar revision, and in 67% of the replanted fingers and 94% of the flaps, we were able to save it. In conclusion, leech therapy should be an integral part of the armamentarium of the reconstructive surgery. It improves greatly the success of the surgery in case of postoperative venous congestion, and the chances to save the fingers and the flaps is much bigger. Thank you very much.